So when a patient comes to me and they've tried 2-3 antidepressants and their depression, anxiety or OCD has not gotten better, then the discussion usually involves something called TMS or Transcranial Magnetic Stimulation. So one of the first questions most of the patients will ask is, how does it work? And it's a fair question. Now, if you tell somebody, hey, we are using magnets to treat depression, it sounds like science fiction, but it is not. It is FDA approved since 2008 in US, and the science behind it is as simple as what you see in an electric motor or when you get an MRI done. The science is exactly the same, and let's dive into it and let's try to understand as much as possible how the TMS works and how does it help to treat depression, anxiety, and OCD. So the basic principle is that a magnetic field is converted to electricity in our brain. So what happens is when you place the coil on certain areas of the brain, of the magnetic coil, it's an electromagnet. That means it becomes a magnet when we pass electricity through it. So as we are passing the electricity, the magnet is turning on and off very fast. So if you have a science background and you are aware of what we call Faraday's law, when you switch off the magnet very fast with the electric field, it generates a magnetic field around that coil. And that magnetic field, the bone of the skull does not stop it. So the magnetic field goes into our brain in that specific area of the brain where we are producing the coil. And that magnetic field produces a very gentle electric field in that area of the brain. And what the electric field does is it makes the neurons fire in that area of the brain. So when the neurons fire, the circuit gets activated. And when the circuit gets activated, then the signal goes from one area of the brain to the other. So in TMS, we target very specific areas of the brain. So why we target those specific areas? So when they did their research and they did something called functional MRI, which shows the areas of the brain which are active or not active when somebody is having for example, depression. So there is an area called left dorsolateral prefrontal cortex, which is on your left side. And that is one area which is affected when you're having depression, you have low motivation, low energy, you're not feeling like doing anything. So that area becomes what we call underactive. So when we place the magnet there and we send the pulses, it makes the neuron fires in that circuit. And there's a specific frequency we use, it's called 10 Hertz frequency. And when the neurons fire, the circuit gets activated. And when the circuit gets activated, then it takes the messages from this area to the deeper areas, emotional centers in our brain like hippocampus and amygdala. We do it multiple times. So when you come in and we do multiple sittings, so it's like we are sort of exercising that brain circuit, that emotional circuit in the brain over and over again. So it's like building muscles. So if you want to build muscles, you have to go to the gym every day and you have to work out the muscles every day, and over a period of time the muscles become stronger. Similarly, out here there is a thing called neuroplasticity. So what happens is once we stimulate the circuits, there are certain chemicals released in the brain which automatically then start sort of encouraging the brain circuits to become stronger, the neurons to become stronger, grow in size, spread out. So just to make that circuit strong so that it becomes normally active, not underactive. And so once it becomes normally active, the depression is gone. Similarly, for other conditions like OCD or obsessive compulsive disorder, we target a different circuit, and that's called the supplementary motor area or medial prefrontal cortex. For the anxiety, we target the right side of the brain. We target the right dorsolateral prefrontal cortex. So the areas might change depending on your condition, and the frequency which we stimulate might change, but the basic mechanism is the same, that we are making the neurons fire, we are making the circuit stronger, and we are increasing what we call neuroplasticity. So that means that the brain sort of starts pairing the circuit and making the circuit stronger and making the neurons stronger and sort of wire together. So a lot of times people are a little bit afraid of what the session would be. I mean, it's a magnet is turning on and off, and it makes a clicking noise when it turns on and off. But actually, the session itself is quite unremarkable or even pleasant. So most people would sit in an easy chair while the magnet is placed and the treatment is going on. The treatment usually will last anywhere from 3 minutes for theta bursts to like 15 to 20 minutes for longer protocols. And in that time, most people are either watching TV, which is there in the room, or they're resting, listening to music, or there are some people on the phone also scrolling. So it's not affecting you in any way. And I mean, it's a tapping sensation, which might be feeling a little bit unusual, but not causing any major disruption. And so once the session is over, you can get up, you can go, you can drive yourself, you can go to work, you can exercise, you eat normally. So there are basically no restrictions there when it comes to during the treatment of TMS. So you can carry out your normal activities as much as possible while the treatment is going on. So how long does the TMS treatment last? So as I had discussed previously, it's like going to the gym and building your muscles. So if you go one day and work out for 4 hours, it's not going to build your muscles. So you have to go every day, and it takes a little bit time before you start feeling the difference. So similarly in the TMS, we do like 30-35 sessions to have a lasting effect. There are different protocols we use. Of course, there are accelerated protocols now with theta burst. There are protocols where we can do in 5 days. The latest protocol which is out is a 1-day treatment protocol where we do multiple sessions in 1 day, and it's also effective. And the usual treatment, if you do the usual way, will be anywhere from 2 to 4 weeks. And most people, of course, it takes 10-15 sessions before you start. But by the time it's 30-35 sessions, but to see the full effect of the TMS, because once you've done it, the brain, as I said, the neuroplasticity has increased, which by itself also continues to cause improvement. So sometimes to see the full improvement can take up to 5 to 6 weeks. Most people are okay once they've seen the improvement. Some people they might have to do some boosters from time to time, depending on how severe your illness is. For some people, they might have to sort of take a low-dose antidepressant for some time, especially if they've had like multiple sessions or if they have a strong family history. For some people, they might combine it more with like psychotherapy, and some people who have been able to maintain it with regular exercising or regular yoga and pranayama therapy. So the next things the patient will ask is the TMS safe? And it is one of the safest treatment we have in mental health. It's much safer than medication. It does not have like sexual side effects, weight gain, and emotional blunting, which you see with the medicines. Unlike the ECT, there is no memory loss. You don't have to take an anesthetic agent. So it is definitely one of the safer treatments. The most common side effect is, as I said, where we place the magnet and there is clicking, so you might feel some discomfort there, and few people have had some headache, which may last a few days or a week or so, but usually as you get used to it, the side effects do tend to go away. One of the most serious side effect, which we see very rarely, is risk of seizure. And there has been some documented cases since the treatment has started since 2008. And those risks have decreased with the new protocols we use. And if you screen somebody carefully, the risk is almost minimal. And so usually we screen you before we do it. And if you have active seizures, we might not do it. Or if somebody has history of alcohol, current alcohol use, high amount, we might not use it. And if you have certain implanted devices, we might not use it. So a proper screening is done to make sure that the TMS treatment is safe for you. So then we say if the TMS, as I said, it has a unique mechanism of action where it increases neuroplasticity and activates the circuits in the brain. Why is it, or how rather, it works is very different compared to what we have right now, like medication and therapy. It is not used for all the conditions, but a lot of conditions now we are using the TMS to treat. So the common conditions are like depression, what we call treatment-resistant depression, bipolar depression, OCD or obsessive compulsive disorder. We use it in anxiety. We use it for post-traumatic stress disorder. We have also used it in addictive disorders. We have used it in kids with depression. And we also use it, but more neurologically, for migraine, after stroke in a patient, and for sometimes what we call tinnitus, ringing in the ears. A lot of research has been done in these fields, and we know that this treatment is highly effective. Of course, it's a treatment. It's not 100% effective. There are some people who do not respond to it. But majority of the patients who undergo the treatment will show some response. So TMS, as I said, has a very unique mechanism of action. It uses powerful magnets to stimulate gentle currents in your brain circuits and in your neurons, and it makes the neurons sort of fire and exercise and makes the circuit stronger, increases what we call neuroplasticity, so that then the brain heals itself. And when the circuit is stronger, then whatever underlying condition you are dealing with, be it depression, anxiety, OCD, or other conditions, the symptoms do tend to resolve.